What is Semglee, Insulin Glargine? Semglee, also known as Insulin Glargine YFGN or simply Insulin Glargine, is a long-acting insulin medication designed to help manage blood sugar levels in adults and children diagnosed with type 1 diabetes or type 2 diabetes. This medication is typically injected once daily under the skin to provide consistent, 24-hour blood sugar control. The appropriate dosage of Semglee, Insulin Glargine, varies depending on individual factors such as diet, activity level, and blood glucose patterns. It is available in both vial and pre-filled insulin pen forms, offering flexibility for different patient needs. Common side effects of Semglee, Insulin Glargine, may include mild redness, itching, or swelling at the injection site, as well as upper respiratory tract infections. Semglee, Insulin Glargine, is recognized as an FDA-approved interchangeable biosimilar to Lantus, Insulin Glargine, meaning it provides the same clinical benefits and safety profile at a potentially lower cost. What is Semglee, Insulin Glargine, used for? Type 1 diabetes, T1D. For individuals whose pancreas produces little or no insulin, Semglee, Insulin Glargine, replaces this essential hormone to maintain balanced glucose levels. Type 2 diabetes, T2D. For patients who cannot achieve adequate blood sugar control with oral diabetes medications alone, Semglee, Insulin Glargine, helps improve long-term glucose regulation. How Semglee, Insulin Glargine, works. Semglee, Insulin Glargine, functions as a synthetic, long-acting form of insulin, the natural hormone responsible for regulating blood sugar levels in the body. After meals, insulin allows the body's cells to absorb and store glucose from the bloodstream, while also signaling the liver to reduce its production of glucose. In people with type 1 or type 2 diabetes, insulin production or utilization is impaired. Semglee, Insulin Glargine, provides a steady release of insulin over 24 hours, helping the body maintain stable blood glucose levels throughout the day and night. By mimicking the body's natural, basal insulin activity, Semglee, Insulin Glargine, supports effective diabetes management, helping reduce the risk of complications associated with uncontrolled blood sugar levels. What are the side effects of Semglee, Insulin Glargine? Like all medications, Semglee, Insulin Glargine, may cause side effects. Many of these effects are mild and tend to improve as your body adjusts to the medication. However, it's important to stay in close contact with your healthcare provider, especially if symptoms persist or become more severe over time. Common side effects of Semglee, Insulin Glargine. In clinical studies, several side effects were observed in people using Semglee, Insulin Glargine, especially those with type 2 diabetes, T2D. These effects are generally mild to moderate and may include upper respiratory tract infection, up to 29%, swelling in the hands or feet, edema, 20%, high blood pressure, 20%, flu-like symptoms, sinus infections, or bronchitis, up to 19%, cataracts, 15%, joint pain, 14%, pain in the hands and feet, 13%, back pain, 13%, cough, 12%, urinary tract infection, UTI, 11%, diarrhea, 11%, depression, 11%, headache, 10%. These side effects are typically manageable and often decrease as treatment continues. Still, always report any persistent or bothersome symptoms to your healthcare provider. Serious side effects of Semglee, Insulin Glargine. While rare, serious side effects can occur and may require immediate medical attention. Contact your healthcare provider right away if you experience any of the following: severe hypoglycemia, dangerously low blood sugar. Symptoms may include shakiness, nervousness, fast heartbeat, sweating or chills, confusion, extreme hunger, or weakness. If untreated, severe hypoglycemia can lead to loss of consciousness, seizures, or even death. Severe allergic reactions. Signs include difficulty breathing, swelling of the face, mouth, or throat, or blistering skin rash accompanied by fever. Low potassium levels, hypokalemia. This may cause muscle weakness, cramps, irregular heartbeat, digestive problems, or kidney issue. Semglee, Insulin Glargine. Dosage forms and typical dosing. Semglee, Insulin Glargine, is available in two main dosage forms: pre-filled insulin pens and vials. Both contain 100 units of insulin glargine per milliliter, 100 units per ml, and are designed for once-daily subcutaneous injection to maintain steady blood sugar control in people with type 1 or type 2 diabetes. Available dosage forms and average costs. 1. Pre-filled pens, carton. Dosage: 5 ml pre-filled pens of 100 units or ml. Quantity: 1 carton. Average price: approximately $393.87, with GoodRx coupon. Retail price: around $492.19. Discount: roughly 20% off the retail price. 2. Vial. Dosage: 10 ml vial of 100 units per ml. Quantity: 1 vial. Average price: approximately $265. Typical dosing for Semglee, Insulin Glargine. The dose of Semglee, Insulin Glargine, varies from person to person. Your healthcare provider will carefully determine your dosage based on your type of diabetes, body weight, diet, activity level, and blood glucose response. For type 1 diabetes, the total daily insulin, TDI, dose will be individualized. Typically, Semglee, Insulin Glargine, provides about 30% of the total daily insulin requirement, given once daily under the skin. Rapid-acting insulin is usually added at meal times. For type 2 diabetes, the usual starting dose is 0.2 units per kilogram of body weight, or up to 10 units once daily, injected under the skin. The dose may be adjusted gradually to reach the desired blood sugar target, under the supervision of your healthcare team. Because Semglee, Insulin Glargine, is a long-acting basal insulin, it helps control blood glucose throughout the day and night without the need for multiple daily injection. Semglee, Insulin Glargine. Contraindications. Certain conditions make it unsafe to use Semglee, Insulin Glargine. These are known as contraindications, and it's essential to discuss them with your healthcare provider before starting treatment. You should not use Semglee, Insulin Glargine, if you experience episodes of hypoglycemia, low blood sugar. You are allergic to insulin glargine or any other ingredients in the formulation. If you have a history of recurrent low blood sugar, severe allergic reactions, or insulin sensitivity issues, your healthcare provider may recommend an alternative treatment plan. Pharmacist tips for Semglee, Insulin Glargine. If you're prescribed Semglee, Insulin Glargine, following best practices can help ensure you use this long-acting insulin safely and effectively. Here are key pharmacist-recommended tips for managing your diabetes treatment with Semglee. 1. Never share pens, syringes, or needles. Each Semglee, Insulin Glargine, pen, syringe, or needle is intended for one person only. Sharing them, even if the needle is changed, can lead to the spread of serious infections or blood-borne diseases. Always use a new, sterile needle for every injection. 2. Monitor your blood sugar regularly. Check your blood glucose levels as directed by your healthcare provider. Keeping a consistent log of your readings helps your diabetes care team track your progress and make necessary dose adjustments to your Semglee, Insulin Glargine, or other insulin medication. 3. Be aware of low blood sugar, hypoglycemia. Using Semglee, Insulin Glargine, can sometimes cause dangerously low blood sugar levels. Recognize early warning signs such as sweating, shakiness, hunger, anxiety, confusion, or disease. Always carry a fast-acting sugar source, like glucose tablets, fruit juice, or candy, to quickly raise your blood sugar if need. Tips on how to use Semglee, Insulin Glargine. Your healthcare team will guide you on how to properly inject Semglee, Insulin Glargine. Always follow the instructions for use included with your prescription and ask your pharmacist or care team if you have any questions. Before each injection, check that the Insulin Glargine solution is clear and colorless. If it looks cloudy or contains particles, do not use it. Contact your pharmacist for a replacement. Inject Semglee, Insulin Glargine, under the skin, subcutaneously, typically in the stomach area, thighs, or back of the upper arms. Rotate injection sites with each dose to prevent hard lumps or thickened skin. Avoid injecting into areas that are bruised, scarred, or damaged. After injection, dispose of used needles and syringes immediately in a FDA-cleared sharps container or a heavy-duty household plastic container, like an empty detergent bottle. Never throw used needles or syringes directly into household trash or recycling bins. Tips on storing Semglee, Insulin Glargine. Proper storage is essential to maintain the effectiveness of Semglee, Insulin Glargine. Unopened vials and pens. Store in the refrigerator until the expiration date or at room temperature for up to 28 days. Opened vials can be stored either in the refrigerator or at room temperature for up to 28 days. Opened pre-filled pens must be kept at room temperature only for up to 28 days. Do not refrigerate once opened. Always keep your insulin away from direct sunlight and extreme heat or cold. If you found this video helpful, don't forget to subscribe to HeInfo, your trusted source for science-backed health education. Like this video, share it with others managing diabetes, and leave a comment below with any questions about Semglee, Insulin Glargine, or other insulin options. Stay informed, stay healthy, and we'll see you in the next video.